This is Next Steps for Seniors with your host, Wendy Jones. Each week, Wendy brings resources and information to help guide you through those next steps with elderly parents and loved ones. You can follow, subscribe, and share on your favorite podcast platform. If you have questions or topic suggestions for Wendy, you can call us at 248-651-5010 or email at hello@nextstepsforseniors.com.
Welcome to Next Steps for Seniors, Conversations on Aging. I'm your host, Wendy Jones, and our topic today is really about your body, your health, and we're talking about physicians. Your physicians is our topic today, and we have Dr. Pradhan in the studio with us, in person. How are you, Doctor?
Hey, Wendy. Doing great. How's our listeners? How's everybody doing?
Everybody's healthy and happy, and
Yes.
they have a primary care physician. And then I also have Crystal, our nurse practitioner, Graziosi. She's fantastic. And our topic today is going to be really, what we're going to talk about is medications, vaccinations, and little things like how do you take vitamin D? Because I just learned this from Crystal. Go ahead. Tell them what you told me.
So actually, funny enough, I don't know if a lot of people might not know this, but with vitamin D, you can take it every single day. But if you're not taking it with food, it's not absorbing correctly. So you must take your vitamin D with food. What I often tell patients is to keep it on their dining room table or wherever they eat so that you just take it with your meal at dinner time.
It's so important to know little things like that,
Yeah.
right? It's not absorbing correctly.
And the contrast to that is your thyroid medicine. You're supposed to take it in an empty stomach when you wake up first thing in the morning and not eat for half an hour after.
And also, any antacids you take should not be taken with
Right.
that. So really, truly, how to take your medicine is just as important as when to and what to take.
Well, and so many people are on cholesterol and blood pressure medicine. Does
Yes.
it matter if you take that with food or not? Just curious.
So cholesterol medicine should be taken at bedtime.
Bedtime.
There is a reasoning to that because all the strokes and heart attacks and everything tend to happen early in the morning when your cortisol level drops. So that's why you have to be really careful, and that's when you take it.
Isn't that interesting?
Yes.
And it probably says that on the bottle, but very few of us read the actual
Probably.
small.
Yeah.
It is important to pay attention to side effects, though.
Definitely. Always watch out for the side effects. And everybody is different, but don't overdo it. Don't go on Google, start reading about the side effects.
Just ask your doctor or your pharmacist.
Correct.
Yes, agree with you. Okay, let's talk about vaccinations as we age.
Okay.
Give us an idea of what are some of the most important ones.
So the most important, there are two kinds, right? The ones that you need every year, like flu and COVID, and now RSV, the new one. So those are the ones you need every year. But there are vaccines like shingles, which you take when you turn 50, and it's 2 doses, and you're done for life. You don't need boosters on that. And even if you've had herpes in the shingles in the past, or you've had the previous herpes vaccination, you still take this one. You still
shingles.
need this. Yeah, shingles vaccine.
And
Yeah.
you should get
the virus is herpes virus.
Okay, and you need 2 of those. You can't just take one. You've
Correct.
got to get both, and they're 6 months
They're
apart.
6 months apart, yes. So make sure that you're doing that as well. The pharmacy or wherever you're getting your vaccines, which, by the way, most pharmacies, not a lot of people realize this. You can go to CVS, Rite Aid, well, not Rite Aid anymore. You can go to pharmacies and they will have a vaccine schedule and they will be able to do that for you. So, and a lot of vaccines are covered. So make sure that you go to the nearest pharmacy. If your doctor doesn't have this, go to the pharmacy. They will absolutely have that for you.
And you have vaccines for pneumonia. So, there's a lot of them. So that's why the conversation is so important.
Is it true that once you get pneumonia that you're more susceptible to it or not
You
necessarily?
can, yeah. You can be more susceptible, especially if you're a smoker, you have COPD, underlying lung disease. So there are many conditions. Alcohol. Mm-hmm. Yeah.
So RSV, you said, is a new one this year. So that's just an annual?
Annual vaccine.
Just
you're
started
seeing
last
more?
year,
Last
actually.
year, yeah.
Okay, so you're seeing more of this RSV.
Oh, definitely. And again, with these vaccines, the important thing is RSV comes and you or I might not have a problem with getting RSV and being just fine. Like a lot of people could have flu and be just fine. However, it's the people that are high risk, like those pneumonia, COPD, COPD, asthma, any kind of lung disease. Those are the patients that really should be getting this to protect themselves. And if you're around anyone who you want to protect, you should be taking those vaccines as well, because it's not always someone who can take it, and you can take it for them, so you're protecting them in their place.
So that builds up the herd immunity. So
Correct.
It builds up the immunity in the whole community.
So tell us what exactly is RSV. It's a
It's a
respiratory.
virus. It's called respiratory syncytial virus. It's just a fancy name for a virus. COVID is a virus.
And the symptoms are different than pneumonia.
Yeah.
Okay.
Yeah.
They're similar to cold symptoms, really. A
Upper.
lot of people do not realize it's kind of an upper respiratory infection. They do not realize if they come in with a runny nose, sore throat, those kind of things. We will check them for COVID, flu, RSV, and one of those, usually positive. So if
And the treatment's different.
the treatment is very different for all three, yes.
Well, and let me go back to this is exactly why you go to your primary care physician.
Yes.
And it is really important to have one person that you trust that you can go to on a regular basis that knows you.
Yes.
Because
and again,
they'll see
someone
these
who's
things.
close. If they're close by, you can actually see them and they will continue to take care of that for you. Also, what's really great, we were talking about earlier, is making sure that you check where your doctor might work in a hospital setting near you. So speaking of just being in your community, our office goes to Ascension, Providence, Rochester, as well as Troy, Beaumont. So our patients know that, and they can go to either one of those facilities and know that they can see us. So another huge thing about just being near your doctor and being in the same community as your provider.
The continuity, we just keep it going.
Absolutely.
The continuity of care is really important. And when you're in a hospital and you're right there and you say, hey, Dr. Pradhan, can you come over and see me? Priceless.
Yeah. I'll tell a quick story. I just sent someone to the emergency room, and the emergency room doctor said, she looks fine, but her white count is high, which is usually a marker of infection. But at the same time, this lady has issues with her blood, and that's why her white count's high. She did not have an infection. So if it wasn't for the primary care, ER physician wouldn't know, and they would treat her for infection.
Same thing. We sent a patient to the hospital. We're also in the nursing home. We take care of patients. And we sent a patient to the hospital because of decreasing mentation and increasing weakness. When they got to the hospital, they were being worked up for ankle pain. And so we called the hospital and we're like, no, this is not what's happening right now. We're taking, this is our patient. This is what's happening. And so that continuity is huge because that would have just been entirely missed,
Waste.
right? Such a waste of a visit, a waste of a EMS visit, all of it.
So I'm so glad we're talking about this because when you're in for your annual physical, you can say to your doctor, which hospitals do you
Yes.
do you
prefer,
practice
and
at?
your preference too. You can, as patients, you can give your preference as well. And I know we might be running short on time, but we wanted to cover medications.
Yes, let's talk about that, please.
So please always take your medications to your doctor at least once a year when you're going for your physicals. I have seen people having the same meds in 3 bottles and be taking it. I have seen lists that are not updated. I know a lot of you just get your list, but no, please bring your bottles if you can. And I'm sure nobody's going to refuse that. And that's going to help so much too for your health and your doctor as well.
Well, and you mentioned that somebody brought their medicine to you and they had the same type of medicine,
Exactly.
3 different types of bottles.
Yes.
Correct. So also one really big thing is making sure that you're using the same pharmacy every single time you get something filled, because truly, if you're going to multiple pharmacies, things can get missed. They don't realize there's interactions or, whatever is happening. That's very important. A really big thing that some patients like, and it's great for an aging population or anyone with maybe memory issues or anything going on, but they actually have pill packs that they can do where they put all of the medications and even vitamins inside of these pill packs. So you can find a pharmacy that is able to do this. And if you call around, there's quite a few. Honestly, do you know off the top of your head if there's...
I do feel this is important, a very important topic, because number one, we forget to take our meds.
Yes.
And number 2, we don't know which ones we should take with.
And it'll say AM, PM, lunchtime, so it'll be marked like that. So you just open one pack, take all your pills, and be done for the day or morning.
And you can rest assured that you're doing it at the right time,
Correct.
with the right meds, with the right meal or no meal.
Yes.
Yes.
Yeah.
Yeah, that's huge. We have some patients that come in and they show us their pill packs and we go through it that way too. it can be any way that you want to do it, as long as you're keeping your provider updated.
So anytime you go to your primary care physician, put all your meds in a little brown bag and bring them with you.
Yes.
Yes, ma'am.
I love this advice. And you know what? Even if they don't ask, just bring it.
Just bring it.
They will thank you, honestly.
Yeah.
Even if they don't ask you, they will be very happy you did that.
This is why you're listening to Next Steps for Seniors. All these sweet little secrets that we have that we need to share with you. We also, we've got 1 minute left in this program. What is probably one of the most important things you want to share with our listeners that you see in your office that you're like, I wish they would do a little bit more of? Is it mobility? Is it?
I think mobility is huge. Healthy choices for food is huge.
Okay, no pizza and pop.
Right.
Honestly, as they get older, a lot of seniors really enjoy just living in the moment and eating what they want to eat. And that's well and great, but you really still need to manage your food choices. Don't be eating donuts and cakes and pies and everything for every single meal. You need to get that nutrition in, truly, if you want to keep your strength and keep your brain and keep everything.
End of the day, it's about your quality of life, how long. It's not about how long you live, the quantity.
Thank you. Because you don't want to live forever if you're not healthy. We need to live happy and healthy and long. Yes. So let's do that together. You're listening to Next Steps for Seniors, Conversations on Aging.